So I'm Nancy Munson, the CEO of Bristol Elder Services, the central point for aging services. We know that people want to live in their own homes as they age, but things like Alzheimer's and dementia make that dream a challenge. We also know that in Fall River, about 1,500 people have dementia. And did you know that 1 in 3 seniors dies with dementia? Taking all of these things in account is why we at Bristol Elder Services have joined a national movement to help make Fall River a dementia-friendly community. Volunteers, some of them you'll meet later, Jane Sullivan and Cindy Cardoza, go out into the community and meet with businesses to tell them about what it takes to become a dementia-friendly community. At the end of every session, the employer receives a window cling that shows it's a dementia-friendly business. What we hope is that throughout the community we will see the symbol blossom so that residents know that, hey, come on in. We're a business that can help you with your purchase, your transaction, or your regular activity. I'm going to show you now a video about Jim.
More than 70,000 people in BC are currently living with Alzheimer's disease or another type of dementia. People with dementia are in our communities, working, living, and participating in activities, enjoying their neighborhoods. A part of creating a healthy city for all is creating a place where people feel safe, included, and a sense of belonging. This disease does not just affect older adults. People can develop dementia in their early 60s, 50s, and even 40s. Jim is one of those people, and here is his experience.
My journey started 8 years ago at the age of 58 when I was diagnosed with Alzheimer's disease. It's a strange disease to fully grasp. People look fine on the outside, but the problem, the degeneration of the brain, is inside. It's also a disease that has a stereotype built around it. In fact, there is no stereotypical person living with Alzheimer's disease or other dementia. Everyone has a different journey and will maintain different strengths, abilities, and capacities along the disease trajectory. I want to share my personal experiences with dementia because I hope that they might cause some aha moments or provide a sense of confidence for someone experiencing many of the same things. I hope too it might show that there is life after a diagnosis of dementia. For me, it is so important to educate. I talk about my journey with Alzheimer's to challenge the stereotypes. I believe that through awareness and compassion, we can become a more inclusive community. Recently, I went to buy a newspaper and pulled out change from my pocket. I looked at the coins and looked some more, but couldn't identify the coins to use to pay for it. Out of frustration, I put all the change on the newspaper. The cashier picked up the amount she wanted, and we moved forward. One small example of patience and empathy. Some time ago, when I was at home, I had to call emergency services. In my rush and confusion to dial 911, I realized I should have used our portable phone. I hung up, which I should not have done. I ended up with all these people in our house and the RCMP knocking on the door to investigate why I had called 911 and hung up. A firefighter was asking me questions. So was a paramedic and a police officer. People were milling about and they all seemed to be talking. I gather I handled the situation well enough, but if that were happened today, I wonder, if I were unable to respond adequately, how would the officials deal with me? Would they understand? Would they show me patience? Or would they see a healthy man and discount any thought of a possible dementia? Would they take a more aggressive approach? For 25 years, I worked for CP Air and Canadian Airlines, and during my career, I traveled frequently for business. One particular time at an airport that I knew well, I went up the escalator and then down again, 2 different times. I turned right and then left on the main floor until I told myself to get a grip. I finally asked for help to find my flight. I was astounded at my inability to take charge. Now, 8 years into living with Alzheimer's, I've come to realize that I have good days and bad days. I suppose the same can be said for all of us, except when I have a good day, it means I get to exercise my independence. And when I have a bad day, when my mind is too muddled to do much on my own, it means I need support. For a person who loved and thrived in business, I am now limited in my daily activities to doing one real task a day. Is that frustrating? You bet it is. But my life isn't over. I do have a purpose, like doing this video to tell you that we all have a role in creating inclusive, dementia-friendly communities, so that people like me and the guys in my support group can keep on living as well as possible. People with dementia need to get out. We need to socialize and get exercise. Sometimes to do this, we need a little push and extra support from our friends and families, but also from our communities, from the cashier at the grocery store or the bus driver, to the staff at the local community center, or from the folks just out walking on the street. The first step to doing that is dismissing the stereotypes we hold about people with dementia. Like the time at a hospital emergency room when I insisted my wife Alice accompany me to the examining room because I have Alzheimer's disease. A senior nurse in the ER told me I didn't need her with me because I looked fine. And that's part of the problem, isn't it? How is someone with Alzheimer's disease supposed to look? You can't see the degeneration of someone's brain from the outside. Despite her education and experience, the nurse had displayed a familiar stereotype about Alzheimer's. She'd assumed that as soon as a person is diagnosed with Alzheimer's disease, they immediately become incapable and incompetent. It's probably obvious to say, but looks can be deceiving. And that is the challenge, which is why I wear this lanyard. For me, it's an education tool. I am showing a willingness to talk to anyone about Alzheimer's. I make the most of teachable moments to help break the stereotype of a person with Alzheimer's disease. We all have a role in creating more inclusive, dementia-friendly communities.
Good morning, everybody, and welcome to our presentation. I'm Jane Sullivan, and I'm proud to be a member of our Dementia-Friendly Fall River Coalition. We wanted to start by sharing some distinctions between Alzheimer's and dementia. This isn't a training about the disease because we'd be here all day trying to share that information with you. But we did want you to know that dementia is not a disease or a complete diagnosis. It's really a set of symptoms. So we're going to share with you some of those signs and symptoms so that you can recognize them in the people that you're working with. And then give you some dementia-friendly communication skills so that it will enable you to help them. Alzheimer's is not a normal part of aging. It's an irreversible, progressive, terminal brain disease that's characterized, most importantly, by memory loss, impaired thinking, reasoning, and behavior. And those are some of the symptoms that you'll see in working with somebody with Alzheimer's or dementia. It's not a normal part of aging. And more importantly, it's not just an old person's disease. That's one of the common myths about Alzheimer's and dementia. So what is a dementia-friendly community? We're striving to help Fall River become a dementia-friendly community so that we can support people with Alzheimer's and dementia and their care partners. So this isn't just about helping the individual, but the extended family that might be helping the individual. We want to reduce their anxiety, the stigma that is often attached to the disease, and their frustration in not being able to accomplish everyday tasks that they're used to doing. So we want a dementia-friendly community to have a high level of public awareness and understanding. That's why we're going out to area businesses and agencies to share this information with them. And more importantly, we want to enable those with dementia to continue to live a good life, to stay in the community that they're most familiar with and that they're happy with, so that they can go to area businesses and be greeted with respect and dignity and assistance to the degree that they need it. So a dementia-friendly community lets those with dementia continue to live independently and remain a part of a supportive community, and to give you some skills so that you can help that person to the degree that you think it's necessary and to the degree that they're willing to accept that help. A dementia-friendly community enables those with dementia or Alzheimer's to find their way around and be safe, to maintain their social networks and stay engaged. Regularity and routine is really important to someone who's struggling with dementia or Alzheimer's. And we want them to be able to go where they're used to going. So that could be their area bank, a restaurant, their grocery stores, a pharmacy, the YMCA, senior centers, places of worship, all the places that everybody goes to on a daily basis. As they're struggling with Alzheimer's and dementia, that becomes more challenging. So we want to train these groups, these businesses, so that they can help these individuals stay engaged and stay in the community. A dementia-friendly business is especially important because more and more people are continuing to live in the community. One of the statistics we are seeing, thankfully, is that more people with Alzheimer's and dementia are passing away at home rather than in a nursing facility or in an assisted living facility. We're happy that those facilities offer care, but I think given the choice, everybody would rather stay in their own home with the support of the community that they're familiar with. So you're going to see a growing number of your customers, your clients may have dementia, signs of Alzheimer's or dementia. It could even be a coworker that exhibits signs, or somebody in a coworker's family, or maybe even in your family. You may start to recognize some of the signs and symptoms of Alzheimer's dementia. And basically, providing dementia-friendly service is a boon to your own business. It makes people aware that you've got the communication skills that are necessary, that the individual and their care partner are going to be welcomed in your business. You're going to be treated with respect. You're going to be treated with dignity. So what are some of the signs of dementia? There are a number of them. The disease is different in everybody. So you have to be prepared to recognize some of these signs. The individual might look like or say that they are lost and confused because that memory impairment is affecting their ability to stay engaged. They might have difficulty saying something. They might have difficulty finding a word. They might look like they're looking for someone. If you know the individual, it's going to be really important for you to engage them on a personal level. Call them by name. Remind them of your name, because that's going to give them familiarity with the situation. They might have difficulty communicating. So in communicating with them, you need to be patient and kind. Speak softly, speak slowly. Break down the transaction into simple yes or no questions, simple directives, so that you can keep them engaged in the conversation. You might find that a long-term customer is having difficulty handling a transaction that they have done every week for the past 20 years. It could be making a deposit or withdrawal at a bank. As Jim had difficulty in the video counting out his change to pay for a newspaper. It could be somebody in your store having difficulty using a credit card. They might forget to pay for something, or they might just seem restless, disoriented, anxious, or agitated. They're frustrated. They realize that they're having difficulty with something. So it's a frustrating experience for them. So it's important for you to stay calm, stay engaged with the individual, and do what you can to help them accomplish the task that they're there for. Dementia-friendly communication. Some of these basic communication skills are things that we would hope that you're using anyway, but we just want to reinforce them with you. So basic good communication skills: smile, make eye contact with the individual, introduce yourself or reintroduce yourself. Even if this is a long-time customer and you know you, they might have forgotten your name, they might be confused. Remind them, "Hi, Joe, I'm Jane. What can I help you with today?" Use the person's name or their title. Sometimes it might be Mr. or Mrs. or Doctor. If you know them to have a certain title, use that, because that's going to be reassuring. It's going to bring them back to the situation. Of course, always be respectful. Speak in a calm, steady tone of voice at normal volume. Shouting at somebody with Alzheimer's or dementia doesn't do any good. They don't have a hearing problem. They have a cognitive problem. They're confused. They might be agitated. So just be slow, speak slowly at a normal tone of voice. Repeat your question, break it up into simpler questions where yes or no answers can be elicited. Never argue or correct. If you have to repeat something, don't be agitated about it yourself. Be patient, be kind. Offer them reassurance that you're there to help them get through that transaction. If possible, depending upon the situation, a gentle touch on their arm might be reassuring, or if you need to guide them to a particular area, if you're comfortable doing that and that's acceptable, at your place of employment, you can certainly do that because that's reassuring to the individual. Working on the telephone with somebody with dementia or Alzheimer's can be particularly challenging because they're not there in front of you. You can't look for those visual signs, but some of the communication signs could be similar. Or you may find that the individual is making multiple calls about the same situation. So again, you've got to be patient, you've got to be kind, you've got to be understanding. They might forget the reason for the call, even though you just spoke to them 10 minutes ago. You've got to give them the same information or try to think of a different trigger to reinforce their memory. If you know that their care partner is at home with them, maybe you need to ask to speak to their son, their daughter, their husband or wife, somebody who's there with them that can assist you in reassuring them. Their demeanor, their speech, their level of agitation might give you, those are signs or symptoms that they might have a memory impairment, so that you need to employ these communication skills. But again, just take extra care to listen closely, suggest a word if that's needed, be patient, try to help them through the transaction, on the telephone or in person. And some of these helpful responses apply to both situations, whether you're dealing with someone in front of you or somebody on the telephone. They're all basically reassuring. I'll be here if you need anything. I'm here to help you. Or what can I help you today with, Joe? Be reassuring that you can assist them, that you'll be able to accomplish what it is that they need to do. Be empathetic. Oh, that happens to me. I forget things too. Just be reassuring that you're there to help, and between the two of you, you're going to figure out what the situation is and help them accomplish what they need to do. In particularly difficult situations, again, always remember that all behavior is not communication. It's not just the words that come out of your mouth, but how you say them. What's your facial expression? Do you look impatient? Do you look frustrated? That's not going to help the individual. So if you see that they're getting upset or agitated, again, slow things down. You need to stay calm, use an even tone of voice, ask them simple questions. Are you here to make a deposit today? Or do you want to order the regular thing for breakfast? All simple things that hopefully will get the individual to focus. Think about what they're trying to tell you, suggest a word if possible, try to refocus them. Most importantly, familiarity is going to help. Calling them by name, reminding them of what your name is, or you're here to do what you did last week. Just try to re-engage them in the transaction. Sometimes there are environmental factors that lead to increased anxiety, confusion, so depending upon the setting, is it too noisy? Is the lighting too dim? Is it too hot? Is it too cold? All of those things can exacerbate a situation. Oftentimes finding a restroom is an important issue for the individual or their care partner. So are they easily accessible? Can you show them where they are? Can you give them the time and assistance that they might need to use and find a restroom? Or if it's a particularly noisy situation and they're getting agitated, perhaps there's another quieter area that you can remove them to. In a bank, for example, it could be the manager's office, have them go in and sit down, or it could just be a quiet space away from the turmoil of the business. So sometimes just finding a quiet place to give them a chance to calm down and cool off and recollect themselves might be helpful. And again, if there's a care partner or a family member nearby, obviously you want to engage that person, but always speak to the individual. Don't just speak to their care partner. You want to engage the individual and validate them and keep them involved. Continuing on with the environmental factors, there could be visual or hearing changes that affect the individual. I don't know if you might have noticed when Jim went to go up the stairs, he hesitated a little bit. Stairs going up or downstairs can present a difficulty to an individual with Alzheimer's or dementia because they have spatial issues, detecting depth, navigating tight spaces, shadows. Sometimes an entry mat in a business can present difficulties because they don't recognize it as that. It seems like it's just a blank space. Shiny surfaces, if a floor has just been cleaned, it could look like it's water that they're afraid to step into. And again, background noise can affect everybody's ability to focus on a conversation, to remember what they're there for, to hear you and understand what you're saying. Some of these things you might not be able to control, but it might be something that you need to speak with your administrative team about. So those things can affect an individual. So here are two local resources that we'd like to encourage everybody to take advantage of. Of course, Bristol Elder Services offers a wide array of services to individuals in the community. There's a care partner program available through Bristol Elder Services. So if you're working with someone and they need a local resource, it would be Bristol Elder Services. And then also through the Alzheimer's Association, there's a 24/7 helpline that's available to individuals, to their care partners, and then through their website, there's a lot of information available about educational opportunities, support opportunities in the community. So we can highly recommend these two resources for helping individuals with the disease and their care partners as well.
Hi, I'm Cindy Cardoza. I'm a board member of Bristol Elder Services, and I'm also a member of the Dementia Friendly Coalition. And I'm here to take some of what you've heard today and talk about how it worked in real life. When my husband was 62 years old, he told me that he was starting to forget things. And our lives changed from that day forward. They were never the same. It took about 3 years of many doctors to get to a diagnosis of Lewy body disease. And that's something that no one wants to hear. It's probably, and it depends on where you look, but the second or third most common form of dementia. It's right behind Alzheimer's disease. So in those intervening years, what we did was what I think all caregivers and their patients do is try to keep our lives as normal as possible for as long as possible. To go out and do all the things that we had planned to do when the two of us were retired and we could enjoy life. And we quickly discovered that with the dementia, it takes a supportive community to do that. It takes a community outside of your house to support you. And I'd like to tell you a couple of incidents that happened with us that will illustrate what we've all been talking about today. And I can tell you good things and bad things. So what happens when a community is not supportive? And I'll tell you the bad first. My husband, in the course of trying to find a diagnosis, there were many misdiagnoses along the way. One of them was doctor thought that he was depressed, and told me, quite frankly, that if we treat this depression, his memory is going to come back. And even though there was a nagging feeling inside me that that wasn't true, you hang on to any hope that's given to you that all of this is going to go away. And he suggested that we find something that he liked to do to keep him active, because he was already starting to isolate himself. One of the things he liked to do very much was he liked to shoot pool, and he had liked to do that from when he was a very young man. So I did learn that the senior center near our home had a pool table. And they had elderly men that used to come in a few times a week to shoot pool. And I thought, well, this is great for him. He agreed. And I called the director of the senior center, who was someone who I knew professionally, and I explained what the situation was and what we were trying to accomplish. And she said, send him on down, it'll be fine. So that day, he got in the car. He was still able to drive at that point, and went down to the senior center. And I waited for him to come back with great anxiety, like a mother who puts her child on the bus for the first time to go to school. And you wonder how it all went. Well, when he came home, as soon as I saw his face, I knew it didn't go well. And I said, what happened? And he said, well, I couldn't remember how to play the game. And I knew that I kept screwing up. I knew that I was ruining it for them. They were becoming increasingly angry, and they were frustrated because I spoiled their enjoyment. And he said, and when I was ready to leave, one of the men came up to me and he said, "Hey buddy, you want to do us all a favor? Don't ever come back here." And I can promise you that he never did. So what began to happen was our world, which was this big, started to shrink. So he never went to that center again. He didn't even want me to drive by there. The memory was so painful. You go to a restaurant, and he couldn't order for himself. I had to order for him. He couldn't cut his own food because Parkinsonism is part of Lewy body disease, and he was having a lot of functional problems. His hands were not useful. That was the end of going to restaurants. The supermarket was a landmine of problems. People are in a hurry. They're rushing all over the place, and he's in the way. He can't keep up. So gradually, you cut off every activity that you ever did. You couldn't travel anymore because airports presented challenges like no other. So pretty soon, our life was as big as the living room. That doesn't have to happen if you have the support of the community. Let me tell you what happened, another example of when it works, and it works well. Like everyone else, he had a favorite barber. And he used to go, he went for years and years and years as a well man. After he couldn't drive anymore, I started to accompany him there. And probably for about a 3-year period. And I watched with great interest what happened in that barbershop. There were 2 women who worked there who cut hair. And they knew him well from all the years that he had been going. And over that 3-year period, of course, he was rapidly deteriorating. His condition was deteriorating. But they had a comfort level dealing with him. They treated him like they always had. They greeted him when he came in by name. "Hi, Ed, how are you today? Come on over here." They provided support to him, and as his condition worsened, they provided more support and more encouragement. They never failed to explain what they were going to do, because think about what happens if you're confused. At the end of his life, he didn't really know why he was there. But yet these people were coming at him with scissors, of all things. But he had developed a trust level. He didn't know who they were, but he knew that it was a safe place. The last time we went there was probably within 2 months of his death. And at that time, he was really having trouble, and they recognized that. And I know they felt bad about it because they had a long-time relationship with him. But they showed him the same kindness, patience, and courtesy and compassion that they had always shown him. They spoke to him, not just to me, kept the conversation to light conversation so he didn't have to get involved. He couldn't carry on a conversation at that time. And when he was ready to leave, one of the women helped him on with his coat. And the lady who cut his hair came over to me, and she held my hand, and she put a paper in my hand. And she said, "If it gets too tough, I'll come to your house." That was a huge act of kindness. It doesn't seem like much, maybe to you, but to me, I had one less thing that I had to worry about, one less concern that I had that I wouldn't be able to measure up in terms of providing all the care that he needed. Those are the things that can happen. He went to the same restaurant every day, and I watched them as well. When he could no longer order, they knew instinctively not to put the pressure on him. He ordered the same thing every day anyway, a blueberry muffin, grilled. So the waitress would say to him, "Hey, hi, Ed, you want your usual?" Again, he took the decision-making away from him and allowed him to function in that restaurant, in that place, as long as he could. These are the reasons why I think that it's important, this effort is important, and why we all agree, as Jim said, that we all have a role in creating a dementia-friendly community. Thank you.
So at this point, we'd like to open it up and see if anybody in our audience has any questions for us. Yes.
Yes, how do you get the person with dementia to recognize you?
Well, unfortunately, it's going to be difficult for you to get the person with dementia to do anything in particular. But we want to encourage you to use the communication skills that we discussed today. If you think that person knows you by name, just refresh their memory. As Cindy said, "Hi Ed, how are you today? I'm Jane. I'm here to help you. What would you like to order today?" Or, "Are you here to make a deposit today?" Just reinforce with them that personal relationship. You might know something more about them, a family member, their pet, things that you've conversed with them in the past about. Try to refresh some of those memories to give them the comfort level that they need for that particular transaction.
Thank you.
How does the person actually die of Alzheimer's?
Hey, I think I can answer that, I think. Statistically, about 2/3 of people with dementia die. On their death certificate, you'll see pneumonia. And that happens because the body is failing and people can't handle secretions. They may be immobilized. Frankly, the brain tells the body to shut down. So pneumonia is probably the most common. It was in my husband's case, but it can be anything. I mean, people with dementia are not isolated from having or insulated from having other problems and other diseases. So people with dementia can die from heart attacks. They can anything that, frankly, infections for the most part. Bed sores that get badly infected and they have an overwhelming infection. They don't have the resources to fight it off. So that's typically how it happens.
How do you stop the cycle of calls to a receptionist from someone with dementia?
That's a difficult question, as we discussed during the presentation. I think, again, you've got to use those communication skills, reinforce what you might have told them on the previous call, but you've got to be patient, you've got to be kind and understanding. Perhaps as a care partner with the individual, or you might know that they live with their son or daughter, ask if he or she is there, try to engage them if possible. But then depending upon the nature of the business that you're in, you've got to look at what your employer might allow you to do. Are there certain protocols in place that you need to follow? But I think, unfortunately, it's just going to take some time and patience to reinforce with the person. And perhaps it might be possible to send them a note, here, remember, here's where you keep your savings book, or we've already accomplished your task. So just do whatever you can to be kind and patient and reassuring with the individual.
Can I just add one thing that I would never do, is to say, "I just told you that." Or indicate that, the person is being annoying and they're not going to remember that they just called you necessarily. So you don't argue and you don't tell them, "I told you that 5 times. Because that doesn't work. It only gets them upset and it frustrates you as well.
Another question?
Are there medications that can cure the disease?
And I'll take that one. Yeah, we hear that question quite a bit because people see the ads on TV for Aricept and Namenda, and there are no drugs that can cure the disease. There is nothing that's known to cure the disease. In fact, if you listen close enough to the ads on TV, they'll always have a disclaimer that will say that this drug doesn't change the course of the disease or the outcome. So for some people, depending on what the dementia is caused by, they may get a benefit of improved cognitive ability for a little while, but there's nothing right now. And there are hundreds of drugs in tests right now to try to get to the cause, or at least get to the early onset people and try to slow the disease. But right now, there's nothing.
My mother has started to become very forgetful. What should I do?
Well, I think there are two parts to the answer to that question. One is to educate yourself about what could be leading to that forgetfulness. Sometimes there is another medical reason that could involve a treatment and the issue might resolve itself. If it really is Alzheimer's or dementia, then I think it would be helpful for you to learn more about the disease so that you're prepared to deal with the different stages that mom is going to go through, but also to prepare yourself. The caregiver needs to focus on themselves as well, like Cindy here. Support groups are available in the greater Fall River community. As we mentioned during the presentation, there are a lot of educational programs that are available for both the individual and the caregiver, because it's not going to do the individual any good if the caregiver becomes exhausted. You've got to take care of yourself. You need a break every once in a while, so that could involve some respite care. It could ultimately involve a day program for mom. So you got to focus on mom, but I think you also have to focus on yourself as a caregiver as well.
My mom hallucinates and keeps calling attention to the people that are in the room with us, but there's no one there. How would you handle this situation?
Well, I'll answer for myself, because I know there are different schools of thought about how you handle dementia, hallucinations. Some people think you should correct and other people think you should not. In my particular case, my husband did have hallucinations and they were not frightening to him. He would, and I think that's, if the hallucinations were frightening, I'd talk to the doctor, frankly, to see if he'd get some medication to make the situation a little bit better. But in my situation, I know that he would be looking out the window and he'd smile. And I said, "What are you looking at?" And it took a while for him to tell me that he could see a little man in a tree. He wasn't uncomfortable with the situation, so I just let it go. What I would try to do, because frankly it was more upsetting to me than it was to him, that your husband, who's young and healthy and is hallucinating, is a horror. What I try to do is just try to change the subject and just distract him and let's talk about something else, because frankly it upset me. But if it's scary, I would get in touch with the doctor. And not argue, again, don't argue. Just say, no, they're not there. You know, I mean, I wouldn't do that, because to me, that goes nowhere. Any other questions?
Thank you very much.
Thank you very much.